I want to take some questions from the audience. Anyone got some burning questions they want to ask our panel? Just here, the first hand that went up.
Thank you very much for all you say, and thank you for representing us. I understand the mandate for a strike, and I understand the mandate for still for the first strike. I don't feel that I'm happy with a strike that doesn't provide emergency services, and I'm not sure that we've voted for that. I think we voted for a strike action, but the vote didn't encompass what that would cover, and I feel uncomfortable with that. I wondered if you...
That question for you now?
Yes.
There's a legislative process that effectively, there are lots of hoops that the government is putting more hoops in to make sure that workers effectively, people that have that are in this scenario can't strike. And in those hoops that are put in, we had to follow a certain process to get there. And we were clear actually that we're not going to just follow the basic rules. What we were going to do is we had a focus. We are doctors. We're not just, I don't know, whatever. We have got a priority in front of us, and that priority is to ensure that the patients ultimately are safe. And that's why we put out so much information early. So we gave the NHS 3 weeks warning of what we're intending if the ballot came out the way it did. Because it was actually only a 1 week, you only have to give 1 week notice normally to the NHS. In terms of what people were voting for, I have to say that I think it was, I understand, but I have a feeling that's a pretty minority view. I think actually most people really did know what they're voting for, and what they wanted was the government to understand that this isn't a softly mandate. This is a mandate to actually say, you need to rethink what you're doing. And we have been clear that as our consultant colleagues, SAS doctors, I've never seen so much support across the medical profession. Let's face it, if you get 2 consultants, they'll give you 7 opinions, right? And I've never seen such uniformity within our profession. And they have stood behind us, and they are clear that they will make sure in those second 2 days, if Jeremy Hunt, let's face this, right? Let's be clear on this. This entirely lies with Jeremy Hunt and his government, okay? The choices to get into this are not, as much as lots of people wish to try and turn this into a choice for the BMA, ultimately, this is entirely sits with Jeremy Hunt to do. He has got all the power to make this go away, okay? And he chooses not to do that. So before anyone decides to start, look at ways of, because I've faced this for several weeks, people start asking you questions, there's 2 people in this, it takes 2 to tango, all that kind of stuff. Well, actually no, because this can go away like that if Jeremy Hunt takes away the imposition and actually reassures us that we can have a proper negotiation. I don't have the power to suddenly stop an imposition. He has all that power sitting there. He is the government, he is the Minister, the Secretary of State. He can make this go away like that. Even today, he could have offered conciliatory talks. He chose not to do that. He chose to tweet ridiculous tweets. Someone really does need to take his phone away.
Thanks, Ian. Thanks. I want to take quite a few questions. I think, hopefully that answers your question. I think, the point is, the ball's squarely in Hunt's court. He can make this go away very quickly. He just needs to take the threat and position on. Don't worry, your consultants are there. We don't need to suffer from God complexes. When you are not in hospital, it still works. Your consultants are there. If it was the other way around, we'd be in bigger trouble. We can't be acting up as consultants. So the evidence from abroad when there were strikes, by the way, is that the safety was better, presumably because the consultants weren't doing paperwork, they were actually seeing patients. At the back there, the hand raised quite high.
I feel like, I just want to say a massive thank you, because I feel like you're sort of fighting our battle for us, because we can't do anything. I mean, I've written to David Cameron and emailed my local MP, and I just feel so helpless.
Don't feel helpless. You've got a lot that you can do. You might not be able to strike, but you can come out, you can protest, you can come to the protests, you can even come to the picket lines actually. So don't feel like that. Some medical the med students in the London protest that I organised along with 5 others, 20,000 people turned up. The med students were the stewards. They were the background of that protest. You can do a lot. Don't feel that you can't do a lot. There's something going on in Cambridge, I don't know what, but the London med students are on it, the Northern med students are on it, Southampton students are on it, so it's just a matter of actually raising awareness, and you guys can do a lot.
Opinion before I came, I tried to persuade a lot of my peers to come, and they said, well, what's the point? It's gonna go through anyway. And
you just keep asking questions, and we keep holding more and more events. Eventually,
another thing is, So I want to say a big thank you, for standing up for us, because, there's less that we can do about it. And also, I'd like to thank Heidi for bringing up the point about women, because as a woman, I feel quite, insulted that the government is deciding not to protect pay for women that choose to take maternity leave. And, with the fact that we already have a gender pay gap, and the fact that, yes, it was mentioned that there's so many women now in medicine, but the facts are that they're not actually in the most senior positions. And, there are relatively few consultant surgeons that are female, and, GP partners and things like that. And I just feel like it's a step in the wrong direction there.
Purple jumper, I feel like it will be.
Yes. So I'm a member of the public. I'm not a doctor. I am married to a doctor.
Thank you for coming.
Thank you. Thank you for having us. I'm married to a doctor, and I'm very acutely aware that as a member of the public, one of the reasons I'm invested and I know what's going on is because I'm married to a doctor and because I have doctors as friends. There are a lot of members of the public out there who either aren't interested or don't have the time to absorb the information, who I worry will be absorbing Jeremy Hunt's spin on this. And the question I've got for Heidi is how do politicians, it's a shame that Daniel's not here as well, how do politicians hold someone like that to account when they come out with the nonsense that causes the Jeremy Hunt effect and can potentially cause serious harm?
To be fair to Jeremy, I'm new to politics. A lot of you might know I obviously was only elected in May, and it was only a couple of years ago really that I thought I wanted to try and become an MP. So I probably still observe it in the way that you do actually. And it isn't just the way Jeremy Hunt, this is politics.
But should
No. Why do I get into politics? Because it needs changing. But it's a peculiar environment. If any of you are in my constituency, or Daniel's right to us, come in and spend a day in Parliament, Anthony will know, it's a weird place. But this mix of power, ego, media, the fact that you're so removed from the real world, it creates a peculiar environment. So I don't think it's intentional. It's not Jeremy being extra spin doctor. Didn't Labour, Alistair Campbell, I think, was like the genius spin man. So this is just a thing that happens in politics. I think it's rubbish. Do I want to change it? Yes, I do. But it will take a while, and not in advance of next year, I'm afraid. But it's rubbish.
Anyone who wants to change it?
Sorry?
Are you the only one who wants to change it?
No.
Why are there no other politicians that hold them to account?
The biggest problem, and we're kind of straying off the topic, and we shouldn't be doing that, we should be concentrating on what's important to manage this contract, but so many people are obsessed with promotion. That is all it's about. So they say what they're told to say. And you've either got to be stupid, brave, or not interested in promotion. Pick any of those three to describe me, I'll let you choose.
Brave.
Stupid.
Brave.
To say that's not good enough. And the risk with that is I go nowhere. And that people that speak out go nowhere. And that's a balancing act. I sense in this country, UKIP taught us that, the Scottish referendum taught us that, and we really are showing us it now. But there is an appetite now for people to say let's do things differently. So I'd say maybe it won't have any time for this, but it has to change.
Thanks, Heidi.
Regarding what you said in terms of for how this affects students, you've got to remember this isn't just. I'll give you a very selfish reason why this affects us, right? One day, Yez and I will be probably sooner than you, but one day we'll be senior doctors. We'll be in this gentleman's position, and we want to work. We will have junior doctors with us, right? We hope, and you will be those junior doctors. And frankly, the government keeps offering us deals that essentially trade off our short-term benefit for the long-term benefit of our profession. And I've said that since I came into this job, I'm not interested in those things. I'm not interested in those deals. I'm not interested in trading off one generation against the other. Because ultimately, it affects me in a selfish way. Those will be my junior doctors that come through. And if they are given a job that they cannot do, it affects us directly. And I will end up needing the NHS. My mum has used my mum's had breast cancer, so she basically used the NHS. It is though we've seen it firsthand, right, how the NHS works. It cannot work with doctors like, the future doctors like you, essentially being traded off just for a short-term benefit for us, so that just because one politician needs to save his skin. It's not acceptable.
Thanks, Ian. I can't even see the short-term benefit for us, to be honest. At the back, the gentleman who's had his hand up, you do well on question time.
Sorry about that. I've come from Cambridge City Council, from the ruling Labour group, to bring fraternal greetings and wish you the best of luck.
Thanks for coming, comrade.
I don't see a crowd of militants here. What I see is a group of people who didn't join up to be doctors to go on strike. I think it's essential and important that you get that message out to the public. I, in 1980, was a firefighter. I faced a quandary then that you are facing now. You realise that what is happening is damaging your service, and you have drawn a line in the sand. And may I congratulate you on the size of the line in the sand. Don't go into this with the thought that, like you having a soul and caring, that Jeremy Hunt has a soul. Senior politicians at that level have no soul. I commend you for taking your stand. I'm very sorry. Unlike Heidi, I'm not responsible. I'm sorry that you have been put into this position. And good luck.
Thank you.
Your ideals don't get eroded. I think I was the doctor on the radio who you might have listened to. That book by Jeremy Hunt is Direct Democracy, 2005. Where he, sorry? No, I was in the afternoon actually, so it may not have been. On the radio, they asked me what I want from the strike, and I reiterated what Johan said, is that with a very heavy heart, I don't want to strike, and I don't want to cause harm to patients and their families. And I said personally what I want is an 11th hour intervention from the government, which I'm not sure is going to happen, a complete about face. But I think one of the core issues really is now the confidence in our Secretary of State for Health is so low amongst junior doctors. There's a video on YouTube, on social media, where they juxtapose comments he says with comments which are just the absolute opposite of the comments he said. And I know that's politics and that's editing, but really I think a feeling which is strong amongst a lot of junior doctors and supporters of the NHS is that we just can't negotiate with someone who just doesn't seem genuine, really.
Yes, I'd like to ask you a question and then how you do question. Okay, so you said that Jeremy Hunt offered you these one-to-one cup of tea meetings, which I agree don't really sound that genuine. But as a medical student, I'd quite like you to say yes to that, even if it's just a kind of piecemeal offering. I know it doesn't really get down to the real detail of the principle, but I think anything that the more you can do to seem like you're willing to reconcile, the better, in my view. Also for Heidi, I think it's to your great personal credit and a show of your integrity that you're here today against an audience which don't really support the Conservative Party, like it seems. But what I'd like to know from you is, could this ever go to a political vote? Could this ever be a kind of, could the opposition days, could they table a motion? Could consensus be built up against, with Tory rebels, with the SNP, with Labour Party members? Is that something that you could work on, perhaps?
Okay, so just picking up, if I may, what you put to Johan, if I'm allowed to say, I agree with you. I just think, and I said this to you when I first met them in Westminster a couple of weeks ago. If I'm going to stick my neck out, and seriously stick it out, which I'll do, I need to feel, and I don't mean this to sound so personal to you, forgive me, I don't mean it to the BMA, to have gone to the ends of the earth to try. And I understand why that might stick in the throat, and think, well, why the hell should I? It's of his making. I get why, I really genuinely get why you feel that, I really do. And it's a huge ask.
Not why I feel, but yeah.
Oh, sorry. Well, or maybe why you don't. There are many reasons why you don't want to do it, and I can't imagine.
The personal is out of this.
I think, let me just, hold on, so let me just defend Johan just for 1 sec to both of you there for a sec. So if you go into a shop and you keep asking for a sort of an object that you want to buy, and the shopkeeper keeps saying, I'm not going to give you it for that price, okay? And it's, you think it's the fair price, and you say, no, I'm going to give you this double the price, okay? And he's got a sign on the front of the shop, and it's basically that double inflated price. Would you go back in before that price goes down the window? Or would you keep going back in like an idiot?
Can I just, I have to go in 1 minute, but there is, so just answer the question. The fact is that every time, this health secretary is not about actually genuinely talking to him. Let's face it, right? What he wants, he keeps making this offer with the basis that as soon as someone agrees, there's a film camera outside and it's all over the news. He does not care about the actual talking, because we had discussions, we've talked before. I've met him 3 times about this. It's not like we have any movement. And every time he releases something, he does not send it to us and say, look, what do you think about this? What he does is do a big splash across the newspapers, across the media, and then uses it as an attack line. Every time he stands up in the middle of the House of Commons, what he does is he gives a whole load of lovely words about doctors or the NHS or whatever, and then attack. So if it's a question of pandering to a Secretary of State that is wholly intent on attacking my friends and my colleagues and undermining my profession, then frankly, I'm not going to give him oxygen. Because actually, that's exactly what he's trying to do. What he's trying to do is paint us as essentially, we as a profession are militants, labelling junior doctors as militants. That is completely unnecessary. The way that the Secretary of State, and lots of politicians, keeps talking about, oh, we'll just go and talk to him, He is absolutely clear that he is using every single weapon he can in the political argument to undermine our profession, undermine junior doctors, and that is completely unacceptable.
Yeah,
I think that Jeremy Hunt plays the media and he plays public opinion better than the BMA has been doing. And I think that you've got to do it for the sake of public opinion.
Yes.
And that's what we offered him today.
But to be seen on camera.
What we have said is that we want conciliatory talks. We want to make sure that actually we have a framework to have that discussion that actually achieves a goal. And the fact is that you saw today he threw it in the profession's face. And we will try and find another route out of this. We have to find a route out of this because frankly, this Secretary of State does not care about the NHS and he does not care. Whatever he might have said, he might say there's lovely words about patients. He frankly only cares about his neck.
Johan, just before you go, a couple more questions and then I think we'll bring this meeting to a close. Well, burning questions, wave your hands. Okay, all right, the lady in the whitish pink jumper and then the chap in front.
Jeremy Hunt is using the whole weekend doctors and staffing of hospitals by doctors as a thing to sort of clobber us with. Interestingly, the NHS employers website has actually given some example rotas that they would bring in. Assuming we were to agree every sort of imposition that Jeremy Hunt has sort of posed upon us, actually the two that most mimic my current rota working as a paediatric trainee, currently I work 3 and 8 weekends. The proposed rota says 2 and 8. So even with everything else, the proposed rotas that Jeremy Hunt is putting forward would see fewer doctors in the weekends rather than more. So my question is, has the government really understood what the current staffing structure is in hospitals? Have they had sort of any communications with the hospitals and with the junior doctors as to what we already provide? Because it strikes me that they probably haven't.
I want to say yes. I have to say I don't know, because I don't. But I can't believe for 1 minute that sort of research wouldn't have been done. But
the evidence is there, and so actually, if we go through these weekend counts, actually we're going to see doctors 2 in weekends and 3 in 10 weekends, rather than 3 in 8 and 3 in 10, which is currently the case.
Kind of detail that I want to be hammered out face to face. And I I can't answer that. I haven't done the research, but somebody who has to.
Any other burning questions? Yeah, we've got one just in the photo. Yeah, you can go last.
I just wanted to check in on something that Heidi said about the strike. So the proposed fact that we are going to go on strike. You seem to suggest that there's no point in striking, that maybe that's not what we want. I just wanted to clarify that, because I think you said that to get to that point with our backs against each other, we're not going to get anywhere. And I think, I speak for myself here, and other people might share the opinion, when you're a doctor, you care deeply about things, and you're trained to make value decisions about lives. And you do that through your training, and you get paid to do that. And if 99% of our voting population say, actually, I think you could be better off if I strike and make that point clear to the population at large, the public, then surely, if 99% of people think that, then they should probably be listened to. And maybe the only way the general public will listen, understand, and actually see the severity of the situation is by a strike. Maybe if we fall short of a strike, they just won't see how dangerous a situation we're in. And that's just what I just think it needs to be said.
Good point, well made. I don't know, Heidi, can you comment on what our alternative is? Because Johan can only have so many biscuits with what do we do?
If I'm there, I'll be gin. I don't disagree with you. The strike, particularly the percentage, it's phenomenal. I mean, it's incredibly powerful. I guess what I was trying to say was, and this is just my amateur psychology, it feels to me that the precious time to get a better deal is now. And I worry that if we reach strike day, that means that time has gone. And given my belief, my sense, my feeling that Jeremy Hunt absolutely wants to deliver on this manifesto promise, he's just going to do it, then I worry that we've lost the opportunity to negotiate. That's what I was trying to say.
Do you need a short, sharp shock to realise what we're actually fighting for? Because I don't know if all of us all of us being the UK, know what we're fighting for.
Heidi, who do you think voted in the last election for the collapse of the NHS? you say the mandate is trying to deliver, but who voted to undermine the NHS? But any other burning questions, guys? Okay, in the front.
Hi, this is for Heidi. I'm from the Daily Express, and where we've been heading up a junior doctors campaign for the past 2 months. And you said now is the time to act. So Jeremy Hunt isn't listening to the BMA, isn't listening to the doctors. So do we need to, put this up a level? David Cameron, he surely needs to get involved and do something.
Yeah, maybe.
You must be involved at something.
He's been quite quiet, I feel.
I suppose, to be fair to him, that if you've got in any organisation, if you've got senior heads, you have to lead. That's their job. You empower them and you pick them to do that job, and you let them to do that job. Who knows if this escalates? Who knows? My sense is that actually almost the negotiator needs to come down a level. We need to get more human. This needs to be eyeball to eyeball. Well, tell me why this contract's rubbish. Talk me through what the weak's like in hospital. Well, how can we do it better? But maybe it hasn't been.
When someone's failing at their job, their manager normally steps in.
I think people are thinking of Harry Harman and everyone can see that, even despite the spin. So, what do you do about failing management?
I think what the Heidi is explaining is what's called transactional analysis, because Jeremy Hunt is in the stern parent position, talking down to us like we're children, not having realised that in the meantime we've grown up, we can make our own decisions, take our own risks, etc. And we want him to come to our level, which is the adult level, where negotiations take place and produce results. That's where he needs to come to. So this is one of the dimensions of the problem with him on a psychological level, where he is the solution to the problem. So if he doesn't budge because of his firm beliefs in what he believes, then we can't see a future with him.
Well, mate, are there any members of the public still sort of just about here? I guess. Yeah. find it useful? When you see doctors at the pickets on that 1st of December, do you think you'll understand why?
Yes.
Yeah.
Did this help, this meeting?
Yes.
Did you understand
This is the
before?
publicity that you need to be doing. This is the sort of effect that you need to achieve.
Well, did it make sense before, or was it a bit of a blur? Yeah, it
It
did.
makes sense to me before, yeah.
Okay, anyone else? Did it make sense to yourself?
I'm a member of Cambridge Keep Our NHS Public, which is a national organisation campaigning to keep the NHS public. And we've been seeing this coming because the junior doctors are just the front line. There's all the ancillary staff, all the other staff going to be targeted. And the eventual outcome for the NHS is to be sold off to private for-profit providers.
Yeah. One last question just at the back then.
My worry is that we're saying this is the eventual outcome, that it will be sold off, etc., and there's books that Jeremy Hunt has written saying that is also his stated aim. My problem is that by striking and by threatening to move to other countries, we're also using that threat, and that's what he wants. I don't see how we're going to get any movement forward when we say we'll strike and the NHS will fall over.
You're quite right. I'm afraid it's put himself in a win-win position. Either we succumb to a contract that's dangerous for patients and the NHS is undermined, or we leave and the NHS is undermined. So that's the problem. Is he's put himself in a win-win position with privatisation. How do you stop that? I don't know. Sundeep, you want to take that?
Yes, I would say that having listened to Heidi this evening, there is still honesty and integrity in the Conservative Party. It's Heidi. And I think that the Prime Minister needs to recognise that there are still people in his party that have honesty and integrity. And people like Heidi should be doing Mr. Hunt's job.
I think that's a very interesting point about what happens after August. Because suppose this contract comes into force. The first Wednesday of every August, all the trainee doctors move to their new job. And if we're lucky, we're shown the contract. Certainly for the last 4 years, I've never actually seen my contract that I work on.
Maybe this will vote rise as well.
But I will go back several decades to Nye Bevan, who said, the NHS will survive so long as there are folk with the strength and the will to fight for it. I've not run out of fight. And I don't think any of my colleagues have either. Now, I've said this before, it takes a lot for a geriatrics registrar to get peed off. and you know, Jeremy Hunt has offered Johan a nice cup of tea. I've offered Jeremy Hunt a cup of tea. And my letters go unanswered. My emails go unanswered. He refuses to engage with us. It doesn't have to be in a public forum. I don't want Jeremy Hunt to be sacked. I don't want him to have his position removed. I want him to do the job he was elected to do, and I want him to do it well. I want him to deliver a good, strong, professional NHS for the benefit of our patients. And come August, if this contract is imposed, there will be thousands of junior doctors who will either resign and seek locum work, resign and seek other diverse career paths. Because I think one thing this palaver has demonstrated is junior doctors have a very broad set of skills. And a significant number of junior doctors will be leaving this country. So I'd really like to know that if Jeremy Hunt gets his way, and he does get this contract that he so covets, what's the plan for next January, and the winter after that, and the winter after that, when the junior doctors are not here, when the junior doctors are not coming in on the Saturday and Sunday, when we get text messages from our NHS trust saying, black alert, all junior doctors, is anyone willing or able to come in? And then they come in, and then they get a parking ticket, because there are so many junior doctors who turned up over Christmas period for free last winter, when we ran out of respirators, because there were only 9 in our hospital, and so many people were coming in with pneumonia. When those junior doctors were turning up and getting parking tickets because there was no place to park. well, what's going to happen next winter and the winter after that when the junior doctors aren't here?
Surely the plan is obvious, like what the government will do when junior doctors out there. They'll say the NHS is unsustainable, this isn't working, and bring in something else.
Thing is, if they bring in something else, who are they going to bring in? Because with the new with the cap of the locum agencies, because people get locum rates, and right now as a registrar, overnight and on weekends, I'm usually the most senior doctor in the hospital. And the medical registrar job is possibly one of the worst jobs in the hospital that one can do because of the responsibility and the time pressures that are placed upon you. If you're then saying that you're going to slash the rates paid, the locum rates paid, to something the equivalent of £23–24 an hour after tax, people won't do it.
How long do you allow somebody in power to continue in incompetence? How much damage do you allow them to do before you say, actually, it's time for you to go?
Well, I think they've not been in power for about 3 years or something like that. So far, that's the tally.
I've been trying to do this way, but you're right. You went from a failed marmalade export business to Japan to a failed B-Sky B bid to now this. Precisely, it's time that this person's history as a poor leader is exposed. Most of the audience here will know about this, but it's been such a long time, such a historic sort of potentially vote to go to a strike that the BMA went on a strike, unanimously voted to strike before the NHS's inception, going back to 9/11, and they voted not to support the NHS because they're all private practitioners. Thanks very much. They were earning good money. Patients had to come in with a few bob to see a doctor, and they didn't want to be bossed around by bean counters like Hunt who tell you how to look after your patients. They have no idea. So actually, they were lured in with money and signed up to the NHS. It's ironic that now that all the problems that those guys worried about are now with rubbish pay, rubbish work conditions. We've got some bean counter telling us about patient safety on the weekends. He hasn't got a clue how to read a paper. And now we're going on strike to protect the NHS, even though we know if it goes privatised, we're going to be better off. I mean, it's a no-brainer. How does he manage to win that war in the media? It's ridiculous, in my opinion. Just the last point there. Is that a medical student? I'll give you the last point.
Thank you. I just wanted to ask Kylie, just back to the point about Jeremy Hunt and the fact that he's scrapping the financial penalties for hospitals that make doctors work too long. What actually is the rationale behind that? Why would that ever seem like a good idea? It just makes no sense to me.
Well, you all know more than I do that the belief that I think he has is that the CQC will do that job instead.
What's the rationale for removing it?
Well,
He wants to save money, not lives.
No. Can I just say two really quick things, because I sense we get an answer pants and people really want to be off and out of here. Honestly, truthfully, look me in the eye, hand on my heart, most sincerely, I do not believe the government wants the NHS privatised. Genuinely, I don't. And I'm entitled to my opinion, and I want to share that with you because call me naive, whatever. But
if you get what you pay for, why are they cutting the GDP spend on healthcare? Why have we got 8% healthcare spend compared to any other first world nation that's pathetic?
Because it's not having enough cash. That's the bottom line.
Well, we haven't got enough cash for a series of war. We've got enough cash for lots of things. We've got lots of cash. That's not the question. Okay, let me just address that one sec. So back in 1948, after a war with Hitler, when we were melting our gates to make Spitfires, we had money for an NHS then. But now that we've got iPhones, 2 cars each, and we've got all this money, but we can't afford the NHS now.
We've also got debt, and a lot of it. But a lot of you probably know my view on the rate at which we should be paying down the debt as opposed to cutting tax credits, for example. So I hope you know that I do have an argument against single-mindedness. But the other thing I just want to say very quickly. I don't want to trivialise what I keep saying about Jeremy Hunt and Johan meeting, but I am just such a firm believer, a real believer. You have to start somewhere, and I want to try. I'm not David Cameron. I can't make Jeremy Hunt do anything or not do anything. All I can do is what I can do, and I'm a new backbencher, and I just want to try with every power of my being to try and get a meeting of minds. And I might have failed spectacularly, but I will offer what I can.
You're doing a great job. We all want to thank you for that.
Can
Can I just give you, as a senior consultant, I don't know if there's any seniors from Addenbrooke's here, I actually work at Hinchinbrook Hospital. I came down here because I wanted to make sure, like many seniors who are posting on the Junior Doctors Forum contract Facebook page, you do have our support. We can look after hospitals. And we've done it. There was a time when there were longer hours, but you must do this, because if you fail, the NHS will fail. They'll come after me, they'll come after the nurses, they'll come after the NHS. We have to win it, and you have our support.
Any other consultants in the room?
I'm one of the consultants who works here, and we don't always see eye to eye with our junior colleagues, but I can tell you that we do on this one. And there's a reason for that, because we see how wrong it is, and we see how everyone is threatened. We are all in it together. And I remember working those hours that you are now fighting back against. I remember falling asleep, clerking a patient, and the patient would wake me up saying, "Please, Doc, can you ask me some questions?" That's wrong. That's wrong. And we've already made, as an audit department, plans for when you go on strike. So we will cover it.
Thank you, Mr. Arnold.
What are those plans?
We're going to do all the work. So that we can cover the emergencies.
I'm John Firth. I'm one of the Deputy Medical Directors here. There's a meeting 8 o'clock tomorrow morning, Lecture Theatre 2, a meeting Alice Fisher 5:30 next Wednesday, where we will talk to you about how we will keep this place running and safe. You've all received, or should have received, an email that went out in my name earlier today to give some details of that.
Is that open to the public?
Sorry?
Are those meetings open to the public?
No, those meetings are for doctors within Addenbrooke's and anybody else who works within Addenbrooke's, simply because of numbers, not because there's anything secret here.
What about students?
So,
What about students?
if there's room, you're welcome. But the issue is that, as has been said, the trust has to have a sort of neutral position on this as a trust. The decision about the doctors, how they voted, is theirs. The decision as to what they do on the day is theirs, and you should make your own judgments. But we will make sure that the place is safe. You mustn't decide because you're frightened that the place won't be safe.
Dr. Firth, can I just come back? Thank you for announcing that. I think members of the public are the ones that are really worried about safety. So I think either something's got to be on the website, which hopefully it will, or maybe a public engagement on that. But the other point I was going to make is of interest. I went into the doctor's mess a couple of weeks back, and people were not talking about normal doctors were not gossiping in their normal fashion. They were not talking about patients, nurses, training numbers. They were talking about an interview at KPMG, about US MLEs, exams in America, and flying to go to New Zealand. And I was just disheartened to go in there as a registrar, thinking I'm going to become a consultant, and these guys are actually not going to be my juniors. And actually, I went and read about it, and I thought, why are juniors burying their head in the sand? What is this? And it reminded me of this sort of almost this Holocaust mentality, if you excuse my crassness. I wanted to read up, what's this syndrome where people comply with an oppressor? And I was reading this nice essay, and it said, all that needs to happen for an oppressor to succeed is for the neutral people to stay neutral. So if you stand and just watch this, then the oppressor will victimise the victim, and it will carry on. So I think we probably need deaneries, trusts, and everybody to actually start standing up and saying, this doesn't sit right, something ain't right.
The trusts have to be in a neutral position over this. You will not find that trusts are able to sort of give clear guidance on this. Individual consultants can speak for themselves, and many have done so. We will make sure that the place is safe. That's what we will do. You must make your own decisions. You cannot expect trusts to tell you yes, no. It's your decision.
Thank you.
Can I ask a small favour? Putting my kind of regular MP hat back on. If there's any way I could get, if we get to that point, updates from you about everything's fine, just my constituents will be asking me questions, I'm sure, about is it safe, my operation, etc. That would be really helpful for me.
I suppose the same with Martin.
When we finish,
Yeah.
we'll sort that out.
Thank you.
Great.
Listen, I'd just like to say one final thing to the medical student at the back. We started off this evening by saying, I feel really helpless. Well, what you've done is you've come along this evening on your own without your student friends because you couldn't persuade them all to come. You've asked very probing questions. You've started on the road to making a difference yourself, and we need more people like you to do what you've done tonight. Credit to you.
Thank you. I think this success. I hope you, especially members of the public, have learned something about these issues. There are some BMA-sponsored badges in the front. There are some non-BMA-sponsored badges to support the junior doctors in the back. They look blue. So please, members of the public, actually juniors, everybody, start wearing these badges so that people can ask you what it means and you can explain to people who didn't attend today. Thank you for coming.